Hi, thank you for joining us today. My name is Keith Bussey, and I'm here with my colleague, Dewana Calhoun, and we work for the Georgia Department of Public Health. Today, we're going to cover the third webinar of the Georgia cAARds webinar series. This webinar is entitled Next Steps Planning and Implementation. Before I get into what this webinar entails, I want to let you know that we have covered already in the series the Georgia Tobacco Quit Line and the Georgia cAARds program overview in the first webinar. And in the second webinar, we've gone over the Georgia cAARds reference manual. Let's get started on this one. Before we dive into the details of the third webinar, we're going to do a quick recap of the Georgia Tobacco Quit Line and the Georgia cAARds program. The Georgia Tobacco Quit Line is a telephone-based tobacco cessation service that's available to any Georgian adult aged 13 or older. Services are provided on all types of tobacco products. It doesn't matter whether or not it's cigarettes, cigars, snus, or dip. Anybody can call. People with chronic diseases such as hypertension or diabetes, they can call and get help with the Quit Line. Like I said, it's available to teens or youth aged 13 to 17. Pregnant and postpartum women can call the Quit Line. Any person, the healthcare provider of a tobacco user, can dial the Quit Line for information. The Georgia Tobacco Quit Line is a public health service that's provided by the Georgia Department of Public Health through the Georgia Tobacco Use Prevention Program. The Quit Line vendor is a nationally ranked vendor with whom I work directly to provide these services to Georgians. It's a free service that is offered by people that have master's level training, and it's available 24 hours a day, 7 days a week, including major U.S. holidays. Now I would like to go through the Georgia Tobacco Quit Line registration process. Once a caller or a patient dials the Quit Line, they are immediately connected to a registration intake specialist. Very basic information is collected on the patient. The intake specialist explains the services that are offered through the Georgia Tobacco Quit Line. The readiness to quit is determined, and if the caller or patient is ready, he or she is transferred live to a quit coach so they can begin the process of tobacco cessation services. In the event that a caller is not ready, what happens is that the intake specialist will provide him or her encouragement to call the Quit Line at a later date. The Georgia Tobacco Quit Line assessment and planning phase. What happens during this process is that the caller or patient will spend about 25 minutes with a quit coach. During this process, the quit coach goes over with the caller or patient their readiness to quit, determine the level of self-efficacy, explain the services, take a brief use of tobacco history, whether or not they tried to make quit attempts in the past, what prevented, what were barriers, things of that nature. And the quit coach and the patient work together to create what we call a quit plan. What's covered in the quit plan involves encouragement for the tobacco user to quit, to try many quits. You know, quitting takes practice, and some people need a little push, or some people need to, do many quits, small victories, in order to be ultimately successful with making a quit attempt. What happens as part of the quit plan, there are educational materials that are included. There's information about nicotine replacement therapies, which are offered by the Georgia Tobacco Quit Line in the form of patches and gum while supplies last. Also in this quit plan, there's information, if available, for local tobacco cessation services in a caller's local area. The quit coach provides follow-up calls to the patient or the caller. There are 4 calls that are scheduled. Usually a call is scheduled on the day of the planned quit attempt. About a week or so after that, there's another call that's planned, and then there are 2 to 3 additional calls planned in accordance to when the quit coach deemed necessary with the caller. These calls, the second and third calls, vary from patient to patient and client to client. And what they usually discuss in those calls, they talk about how the process is going, they build on information that has been previously collected, they identify any barriers, and they reinforce the successes. And the quit coach also provides encouragement for the caller to reach out to him or her at any time they feel they need ongoing support. The Georgia Tobacco Quit Line provides healthcare providers with a patient outcomes report. This report is generated as soon as a caller or patient decides to enroll in tobacco cessation services. The patient outcomes report provides valuable information to the healthcare provider that can be used for medical reconciliation purposes. This is the follow-up part of the Georgia cAARds program where the patient outcomes report comes in to be really helpful. It provides information about whether or not they accepted services, declined services, whether or not they decided to use NRTs, or how many times it took the QuitLine to actually establish a connection with the patient. Now I would like to pass this over to Dewana. She's going to provide a brief overview of the Georgia cAARds program. Again, I want to remind you that the Georgia cAARds program was covered in the very first webinar, and feel free to revisit that webinar for a more extensive explanation of what the program entails. Dewana?
Thanks, Keith, for the introduction. We are so happy that you have joined us today. So by the end of this presentation, we hope that healthcare professionals, public health professionals, as well as employee health professionals attain the knowledge, skills, information, and resources necessary to maximize the adoption of routine evidence-based tobacco cessation interventions. This webinar series, as a friendly reminder, will be posted on the Georgia Department of Public Health's website. So let's learn a little bit more about the Georgia cAARds program and a little history about the Georgia cAARds program. So the history of the Georgia cAARds program is based on California's Do You Card campaign, which was a collaboration between the California Department of Public Health state programs, including California's Tobacco Control Program, as well as the California Diabetes Program, with support from the California Smokers Helpline and the CDC's Office of Smoking and Health. Major partners included California's Medical Association Foundation, as well as the American Association of Diabetes Educators, and the California chapters of the American Association of Clinical Endocrinologists. But in a similar fashion, the Georgia cAARds program, or Ask, Advise, and Refer with Follow-up program, is also the result of a collaboration between two state Department of Public Health programs, including the Georgia Tobacco Use Prevention Program and the Georgia Diabetes Prevention and Control Program. The Georgia cAARds program is a multifaceted educational program that's designed to further assist healthcare providers as well as mid-level practitioners, members of their clinical support team, along with public health professionals with the delivery of evidence-based tobacco cessation interventions. So where are the best locations for Georgia cAARds programs to be implemented? Several settings are ideal for the implementation of the Georgia cAARds program. They include, but are not limited to, hospitals, physician offices, local health departments, federally qualified health centers, as well as health clinics and work sites. The good news is that in some cities or towns, the same patient may be seen in one setting and then referred to another setting for more extensive or comprehensive care or services. So the Georgia cAARds program was designed so that regardless of the settings, healthcare providers and members of their support team are exposed to the same information, resources, and standards in about the same period of time, and are also able to utilize case studies from various locations to, in some instances, either meet or exceed standards. The Georgia cAARds program is designed to align with several national goals, including Healthy People 2020 National Objectives, which are 10-year science-based objectives designed to improve the overall health of all populations. So another example of a Healthy People 2020 national objective related to tobacco cessation is Maternal, Infant, and Child Health Objective 16.3, which is increasing the proportion of women delivering a live birth who did not smoke prior to pregnancy. So the Georgia cAARds program is comprised of resources that are designed to support healthcare and public health professionals beginning as early as the planning phase. But the good news about the Georgia cAARds program is that it is designed to meet a practice or organization's needs regardless of where they are in the process related to tobacco cessation efforts. It is also designed to support practices new to tobacco cessation efforts, as well as practices or organizations with an existing infrastructure that are interested in enhancing their performance. A few more examples that organizations can adopt in order to meet or exceed Any type of planning outcomes may include 1. An organization simply conducting an assessment of their infrastructure and capacity related to tobacco cessation efforts, or an organization may conduct a brief review of their current practices related to care and services provided to tobacco use patients, along with the referral process. For example, it may be helpful for an organization to review its current documentation to examine if these practices may sporadically or consistently identify and screen tobacco users. It's also important for organizations to review their process, including performing a comprehensive assessment review of tobacco users to identify whether these practices are performed sporadically or applied consistently. So in addition to assessing and designating roles to support the ask, advise, and refer with follow-up processes, it may be beneficial for organizations to address a few important questions. Who will do what, when, how often, and as evidenced by what documentation resource. So for example, a few suggestions may include considering performing a query of tobacco user patients who have been serviced within the last 1 of 2 years, or considering to perform a random medical record review to examine the screening process and documentation content to identify and resolve any gaps or inconsistencies compared to any written policies, procedures, or protocol. Once again, it's so important for organizations to keep in mind a few questions, including who will do what, when, how, and how often. So let's move towards a review of steps that are very important in creating a supporting culture. A few examples that healthcare professionals and public health professionals can consider when creating a supportive environment may include sharing tobacco cessation resources with their local community pharmacists and certified diabetes educators. Another example includes organizations sponsoring a lunch and learn session that may focus on how they can apply behavior change theories to address not only tobacco cessation, but weight status as well. So this is such a great avenue for addressing common health behavioral techniques that can be applied to several chronic diseases or conditions involving lifestyle modification and risk reduction. Additional examples that organizations may adopt when considering to create a supportive environment may include ensuring that all members of the healthcare team are aware of and know how to access the Georgia Tobacco Quitline resources, including the referral fax form, as well as other resources. Organizations may also consider featuring Georgia Tobacco Quitline resources and other tobacco cessation resources in their waiting rooms, such as emergency waiting rooms or physician offices in healthcare centers. And finally, other examples that organizations can consider when adopting a supportive culture may include ensuring that members of their healthcare team are supplied with a quick reference that lists reimbursement codes or billing codes related to tobacco cessation counseling. So let's move forward to a few reference manual tips. As a friendly reminder, once priority tobacco cessation patient population groups have been selected for your practice or organization, a few examples of great starting points may include reviewing the Getting Started checklist, the educational course listings, as well as the milestone checklist. The good news is that the Georgia cAARds program reference manual includes samples of all of these documents with proposed timelines as well, but organizations have the option to pace themselves as well. So let's consider a few more tips when using the Georgia cAARds reference manual as just a brief review. The Georgia cAARds program reference manual includes helpful information for healthcare professionals providing care to pregnant and postpartum women, as well as women of childbearing age. The Georgia CAARDS Program Reference Manual also features helpful information for healthcare providers providing care to tobacco users who are hospitalized. And the Georgia CAARDS Program Reference Manual also features resources for healthcare providers providing care to tobacco users who are diagnosed with a chronic disease or condition, as well as those who are not diagnosed with a chronic disease or condition. Teachable moments are great opportunities for providers to educate and support patients and their loved ones with tobacco cessation efforts. Teachable moments can occur at any time, and as previously shared, teachable moments can occur during hospitalizations. However, teachable moments can also occur during other patient encounters, including pregnancy and postpartum visits, as well as new patient visits, and finally during annual physical examinations. Additional teachable moment opportunities where healthcare providers can engage tobacco users as well as their loved ones can occur during urgent care visits, emergency room visits, home health admissions, as well as routine visits, especially when a child is diagnosed with asthma or another respiratory condition. This is an optimal time for a healthcare provider to spend time with a parent or guardian to share with them information about Georgia Tobacco Quit Line resources as well as other tobacco cessation resources. There are additional teachable moment opportunities, and they include when a patient has been recently diagnosed with a chronic disease such as hypertension, diabetes, or COPD, or when a patient has been recently diagnosed with other conditions as well. A few more examples of teachable moments or opportunities include when a patient has discovered that their blood pressure is uncontrolled or their glucose level remains uncontrolled, and this provides a nice opportunity for a healthcare provider to spend a few moments with that patient and share with the patient the importance of tobacco cessation as it relates to improving either their glucose levels or their blood pressure levels. And finally, a few more examples of teachable moments can occur when a healthcare provider or member of the healthcare team is performing a comprehensive medical assessment, and the patient shares with that member of the healthcare team that they have a family history of cancer, heart disease, hypertension, stroke, or diabetes, or when a patient expresses concerns that they will gain weight if they stop smoking. And finally, another wonderful opportunity to share information with tobacco users includes when a patient shares that they are not ready to quit right now, but when they decide to quit, they are unaware of where to go for additional guidance and support. So as we move to a quick wrap up for this webinar presentation, we'd like to remind all organizations and practices that it's so important to keep in mind a few basic questions when planning or implementing any processes. They include who, what, when, how, where. And a few examples more specifically includes who will document, what will each member of the team document, when will we review the documentation, how will we document our actions, where will we document our screening, assessment, treatment, and follow-up actions, and will we select common sections within our electronic medical records to document so that it makes it easier for everyone to locate important information quickly. And as always, we are so delighted that you and members of your healthcare team have taken time to learn more about the Georgia CAARDS program and about the Georgia Tobacco Quit Line.
Thanks, Dewana. We really appreciate your going through the next steps in implementation of the Georgia CAARDS program. What I would like to do now is to talk more about information that you can find pertaining to this webinar as well as other webinars in the Georgia CAARDS program webinar series. So if you would, bring up your browser, type in dph.georgia.gov. That brings you to the new updated Georgia Department of Public Health website. So again, that's dph.georgia.gov, and that's Georgia spelled out. From this page, what you would do across the top here, you see a bunch of links. You would click the program link, or you could just place your cursor over it. It'll automatically populate. And then you'd select Health Promotion. If you were to direct your attention to the left side of the screen, you see Health Promotion and Disease Prevention section. Click that link and then sort of scroll down where you would see the Tobacco Use Prevention Program. Next, continuing to look to the left side of the screen, you will see the Georgia cAARds program Ask, Advise, and Refer with Follow-Up. On this page, you will find a lot of information and resources that DeWanna mentioned in this webinar about next steps, planning, and implementation, as well as information about previous webinars that we've covered. If you were to continue down to the bottom of the page, you see the section where it has related files. In this section, you can download free of charge any PDFs that we have here that'll help you with the next steps in the planning and implementation phases of the Georgia cAARds program. And as always, we both encourage you to reach out to me if you have any questions around any materials or if anything isn't unclear, just feel free to reach out to me. My contact information is listed here on the page as well. With that, DeWanna and I are very happy that you decided to participate in this webinar. Please feel free to go back and visit some of our previous webinars that are available also on the website that I just showed you. Thank you very much for being a part of the Georgia cAARds program.